Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and today we have a special guest, Dr. Haley Amick. Amick? Oh gosh. Dr. Haley Amick, and she is an anesthesiologist. She is also an author, a blogger, a mother, a cancer survivor. What else to your list?
That's a pretty comprehensive list.
Okay, good.
So most of my health history began in October of 2018. I was diagnosed with breast cancer. Pretty immediately had a double mastectomy, axillary dissection, and then underwent chemotherapy for 5 months. Originally, right after my mastectomy, I had a lot of range of motion limitations with my arms. I had axillary cording from my axillary dissection and could not raise my arm, my right arm, much more than 45 degrees. That's all kind of slowly improved with time. It's improved with exercise, yoga, weightlifting. I think there are probably still some range of motion issues that I don't notice as much anymore. And then I also kind of have just universal arthralgias and things like that from some of the hormone therapies that I take.
Teeth together, touch your chin down to your chest. All right, any stiffness or limitation?
Not that I can perceive.
So we should be able to touch your chin all the way down to your chest. So a little bit of limitation in your flexion. All right, now look back as far as you can. That looks beautiful. Anything going on there? All right, head back to neutral. Keep your shoulders still. Rotate your head to the right as far as you can. Beautiful. All the way to the left. Great. With your right hand, reach down the middle of your back as far as you can. Very good. Any stiffness, limitation, pain, forcing, pulling, anything?
No. I feel a little strain here just as it's reaching its limits.
Okay, other side. Good. Anything there?
No.
Okay, relax. Reach from down below as high up as you can. Good. Any discomfort?
No.
Other side. And that's a little tougher.
Yeah, that's definitely tighter.
Any discomfort?
No. Again, it's kind of pushing the limits of my range of motion, but
you are right-handed?
Yes.
I am. Did you play any sports growing up?
Volleyball.
Okay. Yeah, so that's not uncommon to have a little bit of that going on, especially as a volleyball player. Feet together all the way. Bend over, touch your toes. Good. Any stiffness, limitation, forcing, pulling? Come on up. Put your hands over your head and lean back as far as you can. Good. Anything going on there?
A little couple pops.
Yeah, I heard those. Feet together all the way. Twist to your right as far as you can until you're looking at the camera. Good. And now the other side. And that's just not as easy.
Right.
Okay. And where do you feel something going on there?
Maybe my thoracic area gets a little tight.
Okay. And up. What do you feel? What's your experience during that?
My balance starts to get compromised when I go maybe, hitting this point.
Yeah.
Unless I come up on my toes.
Yeah.
And then it's harder and harder to keep my arms straight up.
Stay upright with it. Okay. Good. Goofy position for you. Can you kneel on your knees on the floor? Put your forearms together on the floor. Bring them together like this. That's good. I want you to put this right forearm behind your lower back. I want you to stay centered and rotate to the right as far as you can. And down. Put your forearm back down. Left arm behind your lower back. And twist to the left as far as you can. And that's tough. Tougher than on this side. Correct?
Maybe.
Maybe? Okay. Well, it's certainly a little bit limited on that side. All right, goofy test for you. I want you to reach your arm out as far as you can. Make a fist here. Put your forehead down in the fist. And what you're going to do here is turn your arm out, keep your elbow locked, and raise up your arm as high as you can. down. Okay. A little difficult, a little shaky. Switch hands for me. Out, 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 out. Good. And raise up as high as you can. Good. Okay. Perfect. Didn't know you were getting
embarrassing.
Yeah. Okay, one more.
Oh.
Good. Okay. And what was your experience there?
It's just my strength coming back up, pushing back up is just not there.
Okay, so we looked at Haley's x-rays and they were pretty nice and clean. Going through her movement assessment, we noticed a couple of things. A little bit of limitation in her shoulder motion, both sides, but the big thing was her thoracic spine and rib cage was a little bit limited, and it impacted not only how she moved her upper torso, but also when she did kind of the whole body rotation, there were some limitations there. So we want to take a look at her rotation, and then both the push-up and the squat, where you're looking for core stability and the ability to keep a neutral spine as you move the body. She wasn't able to maintain that neutral spine core stability with either movements. You notice with the squat, she was kind of tipping forward and her knees were collapsing in. As well with the push-up, the elbows were poking out, lots of shakiness and just overall difficulty. So we'll see what we can do to help with that. She mentioned she's a bit uneasy about a neck adjustment, so we're going to ease in and take everything step by step and agree upon whatever it is we do before we do it. What is your current, you mentioned, you run, your exercise, do you have like a schedule or go-to things you do for your physical health and fitness?
I go to a pretty high intensity gym, probably about 4 to 5 times a week, and it's a combination of running, rowing machines, weightlifting, floor.
What's the gym called?
It's called Orange Theory.
Oh, yeah. Okay, I know Orange Theory.
Yeah.
Orange Theory's from South Florida.
Oh, I didn't realize that.
The girl started it in Fort Lauderdale, so.
Well,
Yeah,
I
I've been
love
a member
it.
of. It's killer. My goodness gracious. Okay, so how many times a week do you go to Orange Theory?
Probably about 4 to 5 times a week.
That's pretty intense right there. Okay, and then are there any particular movements, exercises, workouts that they do at Orange Theory or that you do on your own time that you notice difficulties with?
I have trouble with push-ups still.
Did you have trouble with push-ups before the whole?
Not really. I was not as strong then as I am now, but I do struggle more with upper body, just really mostly push-ups. I can do, things with my arms without much limitation, but that's probably the thing I notice the most.
Do that.
Okay.
So I want you to tilt over here. You're gonna shrug your shoulder up. You can keep your hand where it is, but basically, I'm gonna push your head and your shoulder away from each other, both at the same time, and just resist that motion.
Okay.
Ready, go. Very strong. And over here, pushing away. Don't let me. Very strong. Beautiful. So I'm gonna keep doing a bunch of muscle tests, and that tells me what's going right, what's not going so good as far as your body. All right, so make a fist right there. What I'm going to do is push your elbow down into the table. Okay, don't let me do that.
Okay.
However, you don't have to win.
Okay.
Okay, so don't overpower. Okay, so down. Hold it right there and just resist that motion. Ready? Beautiful. Okay? Your thumb and your pinky, bring them together like this. I'm going to pull them apart. Don't let me. Very strong. Beautiful. Okay, elbow in at your torso. What I'm going to do is pull out like that.
Okay.
Don't let me do that. And again, and that's not so great. And I don't know if you could tell, you kind of recruited your front muscles because staying in that retracted position was a little bit difficult. So that was a rhomboid muscle test. So what I'm going to do now is an adjustment to your shoulder girdle and rib cage underneath your shoulder blade. Okay? So, and I'm going to kind of chicken wing your elbow, and the adjustment I'm going to do is down right there. And this is your first chiropractic adjustment.
Okay.
So welcome to the party.
Did it just happen?
No.
Oh, okay.
It's about to, though. All right, take a deep breath, and breathe on out. Very good. All right. Are you still
pretty,
alive?
That was pretty benign.
Okay, good. All right. So now we're going to bring your elbow back in. Stay in that externally rotated position. I'm going to push it out that way.
Okay.
Don't let me.
Oh.
You see the difference? So you were able to actually activate and recruit those muscles that we wanted active. And those support your shoulder girdle, all that good stuff. So that's beautiful. We're going to check some other stuff. How you doing? I'm going to push this way. I'm going to stabilize your opposite hip.
Okay.
So don't let me do that. Ready? Again. Not wonderful.
No.
Okay. So that was your pec major muscle.
Okay. Well.
Pretty important during push-ups and stuff, right? So what I'm going to do now is I'm going to grab your SC joint.
Okay.
All right, and I'm going to do an adjustment there. Obviously, we've got some scar tissue here, so we're going to have limitations in movement. So with chiropractic adjustments, it's the speed, okay, that stimulates the nerves in a way that has an inhibitory effect, kind of a reset button on your motor control of the area. It's the speed that makes it work. So that's why everything is quick when we do an adjustment. What I'm going to do now is adjust right there. But sometimes it can hurt. So what I do, or chiropractic tables have drop mechanisms like this, which absorbs any extra force I put in to do the adjustment to make it much, much more comfortable for you.
Okay.
So what we're going to do, kind of lean forward a little bit and lay back, and it's going to feel super weird.
Okay.
All right, so now I grab your SC joint, which, to be honest with you, feels all sorts of locked up, which would make sense, wouldn't it? So I'm going to bring it over here. You're going to relax your arm a little bit more, and then I will do an adjustment, okay? So breathe out. Good. Hold it right there. Pushing out that way. Don't let me.
Oh, wow.
Little better, huh?
Magical.
Straighten your hand. I'm going to pull towards me. Don't let me. Really good. Pushing towards you. Don't let me. Really good. Make a fist right there. I'm going to push your elbow down to the table. Don't let me. Again. That one was a little bit weaker, wasn't it? All right. Now, the whole thing about stroke and chiropractic neck manipulation. Typically, if you do adjust C1 or C2, that's where the basal artery goes right up there. And if there's any dysfunction, anything crazy in there, that's where there's risk to it, okay? Your muscle that just tested weak was coracobrachialis, all right? The nerve roots that control that muscle come about C5, C6, so the lower part of your neck. I would like to adjust the lower part of your neck. It's pretty darn far from the C1, C2 risk area.
Okay.
Are you comfortable with that?
Yes.
Sure?
Yes.
You can say no. We're at right around C6. So with the neck adjustment, you come on over here and kind of isolate it, and then we're going to do the little adjustment, okay?
Okay.
Very good. And it's right next to your ear.
Yes.
So it's something.
It is. It
Okay.
is.
Now make a fist. Pushing down, don't let me. A little stronger, huh? Good. All right. Put your thumb and your pinky together. I'm pulling apart. Don't let me. Really great. Elbow in at your torso. Pulling out like yay. Don't let me. Not so great. All right. Left palm in your ear. All right. Take a deep breath. Breathe in out. That already went a little early, huh? That's great. Elbow in right there. Pulling out. Don't let me. A little bit better, huh? Good. Make a fist. I'm going to push down.
Okay.
Don't let me. Awesome. Pushing out like yay. Don't let me. Not surprising. Okay, let's bring the old speeder board back. That's why on the table that I actually use, it's built into the table. We don't have to use this stupid thing. Hold it right there. Pushing out that way. A little bit better. I'm going to push diagonally that way.
Okay.
Don't let me. Really good. Okay, so that's good. Straighten your hand, pulling it towards me, don't let me. Really good. And we did thumb pinky already, right? Mm-hmm. Okay. Good.
That was really good.
That was really good?
I was really good at that one.
You were really good at that one. Almost everybody's bad at that one. So that's really, that is
Get a
interesting.
superlative.
Mm-hmm. That right hip was a little weak. I mean, limited in the internal rotation. All right. So we'll mobilize your hip a little bit. A little bit better. All right, muscle test. I'm going to push your knee that way.
Okay.
Don't let me. Ready? Come on, you. Oh, no. Other side. Pushing down. Don't let me. Again. A lot stronger on this side than this side. Your hip flexor tested weak on your right side. The nerve roots to that are about L2, L3. So I'm going to take that segment and manipulate it. Let me see your arms. Turn your head up towards the ceiling. That's good. Ticklish, huh? Okay. All right, so breathe on up for me. Very good. Okay, good. All right, muscle test. I'm pushing down that way. Don't let me. A little bit better, huh?
Better. Mm-hmm.
Good. All right, now I'm going to push down and in, like so.
Okay.
Don't let me. Again. Ah. Down and in on this one. Pushing down and in. I don't like it. Okay. So turn on your side, face this way. So the hip abductors is what tested weak. So about L5 is what we're going to adjust. Comfortable? Mm-hmm. Yeah, right. Deep breath. Breathe out. Good. All right. So I'm just looking for restrictions. You notice how I push over here. There's some give and wiggle. Mm-hmm. I push over there. That doesn't feel great, does it? Okay. There you go. How's that feel? Good. Good answer. All right. All right. I want you to take a deep breath for me. Breathe on out. Take a deep breath. Breathe on out. Cool. Good. Eyes forward. And back. Any pain or discomfort?
No.
Keep going. And back. Give me two more. And we'll switch arms, scoot you over here on the table. We did the arm bar rolling. What was that like for you? Where you held the weight and you turned your whole body?
More of the same.
Yeah.
I could feel things
Try to keep
engaging
your
that
wrist neutral.
don't
It'll hurt the back of your
typically,
wrist, but you're tough.
and you know, it was definitely a
way.
combination of strength and
There it is.
balance,
Back.
and
more.
a kind of a marriage of those things.
Good. Yeah. Beautiful. Okay. Keep that left elbow in there. Good. And you notice that the shrugging of the left shoulder and the elbow kind of flinging out there, right? Mm-hmm. That's exactly where you're kind of having the difficulties. So the push-up, where we took a band that kind of activated some of your external rotators of your, not only your humerus itself, but your shoulder girdle. What was that like to do that?
Illuminating to see kind of what I'm doing wrong from a form standpoint and why I'm doing that.
Yeah.
And also, motivating to try some of the new maneuvers to help strengthen me up in that. And that's one of the areas that has been most frustrating for me since my surgery. So,
Appreciate any difference with the band just now?
yeah, it was keeping me honest.
Okay, so that was our treatment. How'd that go for you?
It went well.
Yeah?
Yes. I saw some improvement.
Mm-hmm.
I've come over to the dark side a little bit.
Yeah,
and it
sure.
wasn't so bad.
Right.
And I see a lot of potential for future optimization of my limitations.
Sure. The scariness of it all, the hesitation, I don't know what you would choose to call it. Now that we're done, what was that? I don't know. What was that experience like for you?
I think it's any unknown, just exploring it and figuring out how to define it, what it entails, making it less unknown is always kind of part of the answer there.
Thank you so much for coming down here to Alcoa to get yourself a treatment.
Thanks for having me.
And facing a monster,
Yes.
I guess we'll call it. You can find Haley at facingmonsters.com and look for her upcoming book about her recent experiences. Do you have any closing comments, thoughts, questions?
I would just encourage all your listeners to come over to the dark side like I did today.
There you go. Thanks so much for watching Treatment Tuesday. Don't forget to hit the subscribe button, leave a comment below, hit the like, and we'll see you next Treatment Tuesday.